It's no secret that cancer screenings can save lives. Breana Pitts spoke to a doctor and a lung cancer survivor about new research that highlights some successes in Massachusetts.
Well, November is Lung Cancer Awareness Month. Statistics show the disease is the #1 killer of men and women in the U.S. But a new report from the American Lung Association shows that more Americans than ever are surviving lung cancer. Joining us now is Dr. Andrea McKee from Leahy Hospital and Medical Center and Pat Everett, a cancer survivor. Ladies, thank you so much for being with us today.
Thank you.
Dr. McKee, we want to start with you. So this report broke down the numbers by state, and Massachusetts is leading in a few key areas. We saw early diagnosis and screening, prevention, and surgical treatment as being some of those areas.
Yes, it's very exciting. We've been working really hard in Massachusetts to promote awareness regarding CT lung screening. It's been proven to save lives. It was proven actually a number of years ago in the National Lung Screening Trial that it's a significant advantage to have a low-dose CAT scan, so not much radiation, like a mammogram, every year if you're at high risk for lung cancer. Massachusetts is at 14%, which may not seem that great, but nationwide the average is about 4%. We really need to get up to the 90+%, and that's what we're working towards.
Pat, you're a lung cancer survivor. You credit screening with saving your life, and you're also the one who advocated for your own screening. Talk about that.
Yes. I am not fortunate to have lung cancer, but very fortunate. Excuse me, this is an allergy, not my lung cancer. Not fortunate to have lung cancer, but definitely fortunate that I was aware already of the protocol, of the recommendations, because I work in the radon industry, which is the #2 killer, cancer killer, lung cancer killer. So, so I was aware, and I went to my doctor when I was having very, allergy symptoms that were increasingly worse, and he said I didn't need a CAT scan. So I went to another doctor, and then a third doctor. Finally, the fourth doctor suggested to me that I have the CT scan, and it was fortunate because there was something there. And then I went on to have a PET scan and then biopsy to confirm it, but it was lung cancer. So sometimes you have to advocate for yourself a bit.
Right, and part of that is the education that's out there available for people, for Pat to realize that something wasn't right. Yeah. And that's part of what we need to do as well.
Yeah, and if anyone has any concerns about whether or not they might be at high risk for lung cancer, there's a wonderful website. The American Lung Association has the Saved by the Scan campaign, savedbythescan.org. You can go to take a quiz to find out if you're high risk for lung cancer and recommended to undergo screening.
Okay, so a helpful and easy way at home. Dr. McKee, how does vaping now play a role in cancer awareness and screening? We've already had 3 vaping-related deaths in the state of Massachusetts.
Yeah, it's awful. I'm extremely concerned about the health of our future generations. Vaping is an epidemic. More than 25% of high school students vape. Unfortunately, it's new. So we don't know yet the long-term effects for vaping in terms of cancer diagnosis. It took 20 years before we saw cancer deaths due to lung cancer from tobacco smoke. So there's a lag. The lung gets injured, and then it takes many years before you actually see cancer diagnoses. But we're very concerned about lung cancer diagnoses. And of course, now we're seeing acute deaths with vaping-associated lung toxicity or VALT. And we really need to get out there and message to children that this is not something that is good for their lungs. Only thing good for your lungs is air.
Right. And perhaps it's a possibility that these screenings have to come earlier down the line because you have this new generation of really young people who have used the vaping and the e-cigarettes at such a younger age than people typically started smoking, maybe.
That's something we'll have to keep an eye on, absolutely.
Finally, what are some of the resources available for people who do want to stop smoking? Where can they go? Where can they find information or get help pretty easily?
Absolutely. So there's information on the American Lung Association. Every year the ALA has the Great American Smokeout. And then there's quit lines in Massachusetts, 1-800-QUIT-NOW. And also talk to your doctor. Studies show that people are most effective at quitting tobacco use when some sort of a smoking cessation aid like Chantix or nicotine replacement is used in combination with counseling.
Pat, is there something that you use to help you quit smoking?
Well, honestly, it was my diagnosis. I mean, it really, and it suddenly becomes you. You don't think it's going to happen to you. You think it's somebody else is going to get lung cancer. But it kills more people than any other cancer, and it is very common in people who, not just smokers, but non-smokers and people who used to smoke. And people have to realize that what the ALA says sometimes too is if you have lungs, you can get lung cancer.
With respect.
Yeah.
I should mention that in our program, people who actually enroll in the program, and it's for current and former smokers, so look at the guidelines. But the longer the current smokers are in the program, the higher the quit rates. We're seeing 3 times the national average quit rate in our CT lung screening program. So it's an opportunity to work with the team to get your lungs healthy.
All right, Dr. McKee and Pat Everett, thank you so much for coming in and talking with us about this very important subject.
Thank you.
Thank you.